Learn everything you need to know about hypovolemic shock for your exam is under 2 minutes. Here is the most important point that so many people get wrong. They think a patient has to become hypotensive before you can call it shock. But what they don't realize is the body fights until the very last moment to maintain blood pressure. So once the blood pressure actually starts to fall, it means the patient has already progressed to a much more dangerous stage of shock. Look at your patient's face. It's extremely pale and cold sweat is pouring down from the forehead. That's because the body is shutting blood away from the skin and redirecting it to the vital organs, like the heart and the brain. Now take a look at the monitor. See how fast the heart is beating. That's tachycardia, and it's usually the earliest sign of hypovolemic shock. The body increases the heart rate to compensate for the loss of circulating blood volume. Go ahead and like the post right now and make sure to save it so you don't lose it. Now let's get to the most important part. The woman's clothes, the bed, and even the floor are covered in blood. So you will always remember that the most important treatment is identifying and controlling the source of bleeding. Because until the bleeding is stopped, it doesn't matter how much IV fluid or blood you transfuse. The patient is still losing blood volume. We have also placed a bag of blood and IV fluid bag in the second. So you will remember that in severe hemorrhage, IV fluid alone are not enough. Many of these patients require rapid transfusion of blood products as well. You will also notice that these patients breathe very rapidly, because when the tissues don't receive enough oxygen, the body increases the respiratory rate in an attempt to compensate for the oxygen deficit.